The respect of the elderly is a core value in the cultures of the people living in modern Zimbabwe. Despite the current modern and world dynamics, older people still play a crucial role in our African traditional societies. The Constitution of Zimbabwe protects the rights of the elderly, who are defined in Section 82 as people who are over the age of 70 years. More so, in 2012, Zimbabwe approved the Old People's Act, which called for the granting of allowances and other social welfare benefits in the country for the aging population. Although the elderly population has legal cover since 2012, the act is still yet to be implemented because of lack of funding. Zimbabwe's elderly people are still facing a plethora of challenges owing to the socio-economic challenges that we are all facing in Zimbabwe. This is Issues Panenyaya, and today we want to take a look at the situation of the elderly in Zimbabwe and also find if there are possible solutions on how their welfare can be better improved and for all of us to be comfortable. My name is Sokostina. On sign language is Siposihle Ndlovu. I'm also happy to welcome in studio Sister Francisca Tsika. How are you, Sister Francisca? Thank you so much. She is a healthcare specialist and has so many years under her belt for taking care of the elderly. I also have Munyaradzi Gwatiringa. How are you doing, Munya?
I'm well, thanks.
Thank you. Munya is from Ethel Evans Hospital. It's an elderly home. It's a home for the elderly, and he also has experience of taking care of the elderly. And lastly but not least, I just found out he's my Sekuru. Hi, Sekuru Tompe Tirivavi. How are you doing?
No, I'm fine. How are you?
I'm very, very well. And I'm glad to have you. He's the acting director of the Department of Social Welfare in the Ministry of Public Service, Labor and Social Welfare. But just before we dive into this conversation, we have a video that we want you to see of Sekuru Chivanga, an elderly man from Maziam Mandu village in Chihota communal lands. He's said to be 109 years old. Let's take a look. We sent Rejoice out into the field.
Wedu se issues panenyaya kunge tiri muno munyika yashenenguo tiri kwa Chihota tiri pamusha we kwa Chivanga vanova vaira moyo kana tinge tasvika pana hatisi vaenzi nekuti tinenge tasvika pamusha isu vaira moyo. Sekuru wangu makadi, baba wangu makadi, tiripo zvedu. Chatiunza pano nhasi ndechekuti tuye tizotenda upenyu, tizotenda kuchengetwa. Sekuru, tiri munguva yakaomarara yekuti upenyu hwakuita chinhu chisina nhando. Ukatenderera pasera pa unonzwa kuti pane nhamo, wopoterera pasera pa unonzwa kuti pane nhamo. Vanhu vari kunyanyisa kuparara vari vana vadiki. Asi tobva tasvika pamusha uno toona tichina sekuru vatiri kunza kuti vaane makore ane zviuru zvakapetwa. Sekuru, mungazive kuti makore enyu amangane ekuberekwa?
Yongoza kuti ndakaberekwa 1918.
1918 ndo iri pachitupa. Asi tadzokera mumashure baba pataa tichikurukura tichizotarisa, manga muchititsanangurira kuti nguva yekutorwa kwezvitupa zvana baba zvaitorwa sei? Imbotitsanangurira ipapo kuti zvaifamba sei, nekuti makore ari pachitupa hasi kunoenderana nemakore ari ekuberekwa acho.
Ivo pacho zvavo vachitaura sevana tichida kubvunzura kuti tinyatoziva kuti baba vedu vako vane makore akawanda zvakadii.
Hongu
vaiti pakutorwa kwezvitupa vanhu vaiswa pasikero nokuonekwa urefu hwemunhu, vozofungidzirwa kuti ndofunga uyu mwana akaberekwa gore rakati. Sekera ndo zvakaitika. Kunyange mukawaona sezvavari vanoita fanika munhu mudiki diki nekuda kwekuti munhu
chimiro chavachi chemunhu akati kwako,
chimiro chekuti akati kwako.
Alright.
Sekera ndo zvakaita kuti vazonzi 1918 vaichango chifungidziro chekuti ndofunga ni 1918.
Alright. Asi mazoita tsvakurudzo yenyu neongororo yenyu sevana, makazoona kuti baba venyu vanofanira kunge vakaberekwa mumakore api?
Tingangoti kuma 109 ikoko
ndo hava makore avo ekuberekwa.
Kana tichitarisa first born yedu yemba medu ichiriko ndeya 1940.
Sekuru, maybe mungade kumbotikurukurira kuti kubvira udiki hwenyu muchinokura muchiwana kungoti panhoroondo yekuti tizive kuti upenyu hwasekuru hwakabvira kupi kusvika patave nhasi?
Ndakaberekwa kusati varungu vawanda kudai.
Alright.
Vanhu vanga vachiri vashoma. Ndakachengetwa, ndakaberekwa namai angu. Ndakangogarawo kusvikira izvinezvi mai vakandisiya, ndikasara vakandisiya ndatoona mudzimai.
Alright. Maive muri vangani? Mumba menyu maive makaberekwa muri vangani?
Mumba chaivo? Taivo 7.
Maive 7. Masara muri vangani?
Tasara tiri vairi.
Saka pano sekuru mugere yenyu mega?
Panapa ndikereka naye vana vangu ivavo.
Maonero enyu imimi semwana mukomana wekunge makuda unosvika kwekupedzisira kwekuberekwa kwasekuru, chii chamunofunga kuti chaita kuti sekuru vachengeteke kwemakore ekunosvika kuma109?
Ini sokuona kwandinongozviita tongoti pamwe kuzvibata kwavo kunge munhu achigara zvakanaka asina matambudziko akanyanya anosangana nawo.
Saka sekuru muri pano zvenyu yakadii miviri sekuru? Pane panorwadza here? Pane panodzimba here? Ndiri kuona mukomana akatosimba chaizvo chaizvo.
Aiwa, ndiri raiti swangu hapana panodirwadza. Ndikere zvangu zvakanaka.
Hambotambudzika nasekuru baba neurwere kana nekudii kana kumbopinda muchipatara vachibuda?
Kwete, asati tambopinda.
Hamusati mambopinda chipatara?
Kunorapwa? Aiwa.
Sekuru?
Hanisati.
Sekuru, chii? Kudya here? Chikafu chamunodya here pamusha pano? Chii chinoita kuti muite utano hwakayemurika zvakadaro?
Ndingangoti ndiye wedenga Mwari.
Amen.
Ndokuti hatingagadzirirwe nemunhu.
Ongu.
Upenyu hwangu haungachengetwe nemunhu.
Ongu.
Ndokuti wakachengetwa ari wedenga.
Amen. Amen. Sekuru vane vazukuru vangani? Mungaziva sekuru kuti vazukuru venyu vakamboverengwa here kuti vangani?
Tatsogara pasi but mazukuru vapo.
Vapo?
Vapo.
Zvekusvika kumachii?
I think 100 vanogona kupa.
Kunyepa.
Oromo.
Kunyepa, saka musha wakakurawo?
Vanogona kuita 100 oromo.
Imi muri second from last. Makore enyu apapi?
Ndine 62 years. Ndakaberekwa 1959.
1959. Alright. Saka imi mune 62. Ndimi second from last. Mukuru ari kuma 80 something. Ndiye wa 1981. Alright. Saka chokwadi kana imimi kwenyu kwatone vazukuruka?
Ndinotori navo
vakatowanda. Nevazukuru futi. Saka sekuru vaona vazukuru vangani?
Kuona kwandiri kuzvita vanga vaona zvizukuru zvina.
Saka taane 5 generations mumusha muno. Wow. Aiwa, tinoda kutenda Mwari nechipo cheupenyu sekuru. Vana variko mazuva ano vakuziva kuti kana vanhu vachinge vakura sezera rasvikana sekuru iri, unonzwa vakunzi vachachengeteka pano pamusha, chiregai tivaendese kunochengetwa chembere, kwavanonovharirwa ikoko vachigara nedzimwe chembere. Handizive kuti pano munozvionawo sei izvozvo?
Isusu panapa hatina pfungwa yakafanana nayo, nokuti kunyange vakatoda kutoti kana kuti vambotorwa nemumwe hanzvadzi yamboenda, tinotoona kuti tinotosurukirwa kuti tinotoone rimwe zuva raunotosvika wotofamba kupitsika muno muyadhi muno wozoti kondiri kuenda kupi, sekuru havapo vakaenda wari nanasisi. Sekera ipapo chinotori chinhu chinototinetsowo neso kunyange tisina kuvaona tite takutota dambudziko. Nokuti semunhu watinogara tichimutsa zuva nezuva
hamudi kuvashaya.
Aiwa, todi kutovashaya.
What a story. What a story. 109 years. But we didn't stop there. We went further and spoke to those that live in the community with Sekuru. Just one. We just spoke to one person that we're going to share with you, and we'll come back and have the conversation in studio. Let's take a watch.
Baba tasvikawo pano tirive issues pane nyaya patatichikurukura nevaridzi vemusha uno sekuru chivhanga pamwe chetepo nemwana wavo mukomana. Kana makagara pano nevai pano pamusha pano, pane ukama here kana kuti kungogarisana?
Pane ukama, tinotovati baba. Vachivhanga tovati baba.
Okay. Tanga tiri kukurukura navo vachitipa nhoroondo yeupenyu hwavo, magariro, tichiona kuti pane munhu mukuru pano wekuti munharaunda medu munototoriwo nemunhu akuma100 ndichakuti. Handizive kuti zvimwe zvezvidzidzo zvatinowana kuvanhu vanenge vana Sekuru Chivhanga zvamungade kutiudzawo imimi semugari wemuno, zvakare muri munhu weukama, ndezvipi zvatadzidza semi munogara muno?
Nezvi tingangoti tadzidza zvakawanda nekuti kana kutovashaya ndofunga pamwe zvezvi tinotonetsekana. Nokuti kana paine zvatiri kuda kuita zvemusha kana zvechikaranga ndo vanototiudza iva kuti itai so, saka tiri kutofara kuti vachiripo.
Tanga tichinzvunza magariro nemhuri, tichinzwa kuti sekuru havana kana zuva rimwe chete ravakambosumudza ruoko kurova mudzimai. Mazuva ano ataakurarama inguva yatinongonzwa bongozozo rakawanda. Handizive kuti munogona kutipa umbowo here hweupenyu hwasekuru nemagariro avo neupenyu hwavanorarama.
Kubvirawo kukura kwatakaita isisu hatina kumbobvirawo taonawo bongozozo pavari nemudzimai wavo kusvikira azoshayika. Hatina chatakamboona. So chimwe chidzidzo chatakaonawo kuti kana nemudzimbawo dzedu ndo zvatinenge chifanirwa kuti tiite.
The story of Sekuru Chivhanga is a phenomenal story, but it's an isolated story amongst a lot of other elderly people that we live with in Zimbabwe. And we're going to unpack more concerning where best should they be. Is it at a home or with you at home? Don't go away. We'll be right back on Issues Paninyaya.
Generally, society has a tendency of shying away from tackling matters that disrupt the status quo. Instead, such discussions are either avoided. As a result, attitudes are created and truth reinvented. On this platform, we dare to venture into those territories. This is Issues Paninyaya.
Welcome to the second segment of Issues Paninyaya. My name is Sokostina. On sign language is Siposihla Ndlovu. Before the break, we were watching a video on Sekuru Chivhanga, who is estimated, I will say estimated, to be 109 years old, although he says he's 101. It should be like 101 if it's 90. Is it 101? My math is so bad. 103. Right. Sekuru Gatitange name. The ministry, what is it doing for men that are like Sekuru Chivhanga and women out there?
Well, we have a number of social protection programs that targets the elderly. Yes, we do have what we call harmonized social cash transfer, which will target also households headed by the elderly, because as we are aware that due to the AIDS pandemic, a lot of young people died and left quite a number of young children in the care of the elderly.
Yes.
So as for us, we make sure that those families that are headed by elderly are cushioned. Then there is a monthly allowance that we pay them under the harmonized social cash transfer. We also have the public assistance. This is also another form of cash transfer that we pay them a monthly allowance for the elderly, and for this one they work in the office, and then if there are any challenges, so with the public assistance, it also takes care of electricity bills and the water and electricity bills, and some at times rentals, particularly if they are renting from local authorities, we can pay rentals for them. Then we also, mainly for those in the communal areas or rural areas, we do have food mitigation strategy, which most people know as drought relief. So we give them, currently we just give them grain per month. In the past, we have been giving them a 50 kg bag per household per month, but with starting from this year, we have shifted to 10 kg per person, so that if the household has got 10 members, which means they'll also get 10 by 10 kgs, they'll get 100 kgs. If they are more than that, it will just multiply by the number of persons in the household. Yes, we also have other what we call levels programs, whereby we are saying we want to strengthen the household economy of these elderly households, whereby we would make sure that at least whatever they can manage to do, then we try to support those projects that they can do, like chicken rearing, if they've got their grandchildren or other people who can assist them, or those that can still do, those that at least they can assist themselves, they can also try to help them so that at least they will be able to fend for themselves.
Okay, so how does one register? You say the ones in the towns can come to social welfare and get a stipend, and I am curious to know how much that is. So how do you know? Do they even know that this is available for them? That they could actually find their nearest local government, Ministry of Labor and Social Welfare office to help them to survive in the suburbs?
Sure, they do, because what is happening is, for us, we do have what we call community case care workers. These are community cadres that work within the communities. So they also help in identifying the elderly who are in need. And then they refer them to our offices. But then with the harmonized social case transfer, we do a census for people who be living in a particular area. So it will capture everyone, including myself. Even if I stay in a particular area, they will capture all my information. Then from the information, that's when we select a needy households, and then we will also cover them under the harmonized social case transfer. But the harmonized social case transfers, we were saying that you would want to know how much it is. For the harmonized social case transfer, a one-member household, you are entitled, currently it's at 1,000 RTGS. Yes, and then
this is for a family, that is in a grandparent-headed household.
Yes, or even just even if not only, but for it also includes, we actually have got categories. Yes, we may have got elderly, we have got the people living with a disability, we have got maybe probably single mothers, widowed, and the things are, but like otherwise we categorize them. Yes, but also the elderly we also have specific, because we do have even a budget line item which is maintenance for elderly. So this 1,000, you also get on top of that electricity and water cover. Yes, if you are in urban areas. Yes. And if you're in rural, Milli Mill on its own is not enough. Yes, we are quite aware Billy Bill is not enough, but currently we are trying to make sure that to work out, to trying to convince Treasury so that at least we work out, make sure that our food basket for rural people should also match those that is being offered by our cooperating partners. Right. Okay, so we have the basics, and of course we'll bring the conversation back, but I want to talk to these two who clearly, one believes in taking care of the elderly at home, and this one believes that they should go to a home where there are other elderly people that are surrounding them. Let me start with you, Sister Francisca. Tell me why you strongly believe that the elderly, they should stay near Madzavo.
Okay, I believe that strongly because initially there was a long back there was a research which was conducted among the elderly, and most of them chose to be cared for at home.
Research yakakavwa nani sinzava?
Haina kuitwa zvayo muno muZimbabwe, yakaitwa kuSt Christopher's Hospice when we were in London.
Okay, isati dakave muno.
Muno haisati yaitwa zvayo.
Okay.
Okay. But vemuno vanhu vakavunzwa, most of them want to be cared for at home. Looking especially on the side of caring for older persons. Okay. They want to be cared for at home. And when we compare home versus hospital, home versus the home for the aged, we find that a person, when they are being cared for at home, they are surrounded by their family members.
Are they really?
Yes, if they don't have family members, at least there will be somebody from the extended family to look after them. Unless if there is no one to look after them, that's when social services is engaged.
But Sister Francisca, let me cut you there and say, haven't you heard, and I read it in the paper every day in the Herald, H Metro Choir, of all the women and men who are being abused by their own family in the homes of the people you call surrounded by family. So, I mean, because I've seen people who are very horrible, they slap them around, they are mad at them that they spoiled themselves.
I hear you. It happens. So this is one of the problems, because of the problem of family conflict. Because sometimes we find that those who are looking after this person, they don't understand that this person is grown old. Maybe the person will be having dementia. And they don't know anything about dementia. They assume that this person is doing whatever they are doing deliberately. So why I'm thinking that being cared for at home is better is because at home they'll have to involve some organizations like the hospital, the clinics.
Would they? Let's tell the truth. They never do. They look for a maid. And Sekuru is even agreeing with me. They never do. They leave you with a maid or somebody else who really tosses you around and doesn't take care of you. Like you rightly said, they don't know you've got dementia. And you know, I know when my grandmother died, and when my mother eventually died, she had dementia. At least I'm learned enough to know that. But some people don't know this. So are you the right people to be taking care of people at home that are old?
I believe so. Because we have to educate the family at home and also give them skills on how to care for the patient. Because even those who are being cared for in the nursing homes, they are also exposed to the same treatment.
No, but they're paid for. I mean, you're assuming. Sister Francis, let's hear from Moya. I mean, you clearly advocate for people to stay at old people's homes. Why?
Look, what's happening now is with kuchinja kuita kurarama kwevanhu, people getting jobs far away, people are migrating to overseas, and you know, so I believe that if an elderly is kept at a nursing home, you know, they are secure. Number one, 24 hours, you are guaranteed that there's someone who's going to look after them. Number two, there is an issue of medication. Some of these people, like she has said, that there's some conditions where they tend to forget. You need someone who is professional to supervise the medication, to supervise if they've eaten the food, if they've eaten the balanced diet food, other than just food. So that's why I believe
Sekuru. Munanenga araswa here akandiswa ku old people's home.
Well, it depends, but I tend to agree with the sister when she said the best place to keep these children is their home, because
these old people, not these children.
Yeah, they are not these children, but these old people. You know, they've got a bond with their natural environment.
No. You usually move them from rural to urban to your houses.
Yeah,
how do they bond?
But you know, even if they visit you, remember they do not want to stay long. They will be bothering you. No, I want to go back.
So what you're saying, Sekuru, is they should be taken care of in their place that they would have acclimatized to.
Preferably.
Not moved to your urban home in the suburbs.
No, if they are used that they've been staying with your family in urban areas, then you should continue keeping them. Both. What they want is make sure that they maintain ties with your family, and they are after they have a good resource of information, a source of valuable information. They are fountain of wisdom. So really, sometimes it's only that if sometimes families do not know.
But how often do you go and visit them at the rural areas?
Not very often.
How often? Let's really give an often.
For myself, I think every quarterly I would say I would not.
So why not put them in a home? I mean, I think for us black people, we are afraid that
no, the idea is like in Zimbabwe.
Yes.
The truth is that we do not have adequate homes. And normally, so currently what we are saying is the homes, the old people's homes should be the last resort. And actually, we need to have a consultation with these people so that at least they will really understand and they appreciate when you move them to a home. Because if you just take them away from the environment, I'm taking you to a home, they will think my children have abandoned me. Or why have I been removed away from the community? Because within the community that they live, they've got either people whom they grew up with, or other people whom they know.
Oh, they're all dead, like security
but they've got Vazukuru and so forth from the area who would pass through and maybe talk. By the way, you are so and so's child. You are so and so's child. Then they will talk and so forth. Oh, that way. But when you take that person to an old people's home, they meet strangers. They are also then they start to develop.
I mean, tell us what happens. All people's home. I mean, these people are assuming from outside looking in.
Right. What happens in a nursing home? I'm taking an example of where I'm coming from. We created an environment which is more like a family. They have got. We have got more activities where these old people have time to interact. Wednesdays they go for library, they go swimming, there's always something. And we have got good people who sometimes come in, like musicians. They come in, they play their music, and the old people are there. They are enjoying
and
what's
how
happening.
Often does family come to visit these people?
What we do is we allow visitors every day.
Right.
Every day, 2 hours. Like during this COVID era now, that's when we started limiting to at least 2 visitors per day.
So looking at what they are saying about going to visit do they actually come and visit these old people when they're in the hospital, or they're also just left there without any attention?
We have got visitors. And what we are doing now is we are trying to control the visitors. Because of the COVID pandemic. But people visit their relatives.
And Sister Francisca is burning here. I mean, I allow you to chime in. What is it that you want to contribute?
Who I'm burning is I just wanted to find out how many homes are in Zimbabwe.
Outside the homes being in Zimbabwe, give me your point. We'll get to the homes in Zimbabwe.
My point is that I still strongly believe that the older persons, those should be given a choice. If they want to go to the home, then they can go to the home.
And if they say to you, yes, I want to go, why do you fight them?
No, if they say to us if they want to go, then they can be given the permission to go. But they should be given the opportunity to make choices, not just to be told that you are now going to your home because you are old, because there's no one to stay with you here.
Okay.
It's unfair on them, because it's also one of their rights to choose, to be given the opportunity to choose what they want, where they want to be cared for.
But did we not, as an African people, grow up without the option of a home? So, I mean, how would you introduce to a person who knows nothing and is at dementia point, and is almost lost all their faculties, and you're asking them, do you want to go to a home or stay here? Because usually, let's be honest, in families, someone will be burdened. There's one person, and then there'll be fights within. You guys are not coming to get. Is it not better for people to take Amai to a home? Everybody contributes a certain amount, which is, I actually know this, it's not even that expensive, and put it in a home and to the home and say, we will all take turns to go and visit or whenever you want without the burdening anyone specifically?
It also depends on the children, on those people that we may think that we are burdening. Because for all you know, they may want to be still looking after their parent who has the dementia, who is bedwetting, or who is doing whatever they are doing. They may want to take care of that person at home.
Absolutely, they might want.
Yes.
But does the situation allow is the question. They work every day. Like me, I'm 7 to 6 o'clock. And probably I leave a maid who is not even trained, doesn't know anything to take care of my mom. You know, you might want to. But does the situation and the environment you've created for them conducive to be at home?
It depends now on your finances. Because if you are going to work, if you can afford, then you can employ somebody, a nurse aide, somebody who's qualified, somebody who's trained to look after the older persons.
Okay.
And you also look for people whom you can fall back on for more information on caring for this person at home.
Do you not think, Sekuru, this person will be lonely while you're at work and doing what you're doing, and all they have is the maid and the TV? Then you only come back from work, my man's gonna say, okay, and then you're off to your... Do you think they're not more lonely?
Yeah,
than taking them to a home where Munya says they're people of the same age, their activities, the things they do every day that still make them feel important and part of a community?
Right. We can say we take them to the homes, but if you currently, if you go to the situation, most homes, they are full. And we have got quite a number of older persons out there, and most of them, and most of the homes that Munya is referring to, these are schemes where people were either self-financing before when they know that when I get older I want to go into these homes. But it's people who had already, it's their culture, or people who had grown knowing that in the end I would not want to burden anyone. I want to
Why
go
do
into
you
a
call
home.
it a burden, Sekuru?
No, I'm saying that's what they say, because I've done the gerontology, I've studied that, and I've had a conversation with them. I call them, they'll tell you that no, myself, I do not even want your Vazukuru to be here. They'll make noise for me, so I want to be alone. Unlike the Gogo is in the rural area, even you say, come with all your children, I want to see them. And sometimes you say, no, but if you come all together, there's no space, but you can't tell you there's no space, because you tell you, no, I want to be with everyone home. So really, this is where I think the issue of choice, and also because the idea is the issue of background and so forth. Because you find most of the homes that we have, the majority of them, you find the bulk of the people who are there, they are people of alien, they are not necessarily indigenous Zimbabweans.
Okay.
Yes. So there was these people now, because they had no one to care, there was no system. Even when they want to retire in rural areas, people they are actually they are abused. They are told no.
So are you saying if we built more homes, it's likely that people would actually take occupation of these homes? Yeah,
I think going forward, people will choose, and then people, because like as I'm saying, that people should have schemes where they contribute. But currently, because you find currently the homes that were say maybe probably they're a little bit, though to me they're not better, is the homes that were contributory, or somebody is financing them.
Right.
Not those that are public, that are being either supported by government, or wholly supported by government, or by a few well-wishers who started. Okay. Actually, the situation is pathetic.
Okay, so Munya is burning here, because, I mean, what is, are you full? Like, are you at maximum right now?
Not really. Because what we have done is, during the COVID era, we've tried to leave a room.
Okay.
We have got the 4-bedded rooms unoccupied, so that if a new occupant comes...
Outside that, Munya, are you saying, he's saying, she's saying there's no space?
No, we are not full.
Okay, so there is space for homes.
There is
We
space.
know you watch COVID regulations. We want to prove to them, because they're saying kwakazara.
No, there is room, and like Arthur Evans, we have got 3 categories The first one, which is more like a hospital setup, and we have got residential care, where someone, if comes, say for example, Gogovaya Vachirwara, and recover a little bit, we move her to residential care, which is the B scheme.
And we will come back to that. I have to go for a break for this argument is getting heated. We'll be right back for the last segment.
Generally, society has a tendency of shying away from tackling matters that disrupt the status quo. Instead, such discussions are either avoided. As a result, attitudes are created and truth reinvented. On this platform, we dare to venture into those territories. This is Issues Paninyaya.
Welcome to the third and final segment. And of course, before we went to a break, we were talking to the panel about which is better, to go to a home or to stay in your home and be taken care of. And I remember Sister Francisca, before we went to the break, asked the question, are there homes in the country? Where is that passion coming from?
No, the passion is coming from the fact that we don't have enough homes to accommodate all the older persons living in Zimbabwe.
If they were available?
Still, if they were available, I'll go back to what I've said before. I would ask them if they want to be cared for at home. And for those who are caring for at home, they need empowerment for the carers. They need to be educated. And they also need, we also need to create support systems for those people who are caring for patients. If they need to know about anything, where do they go to? We have local clinics. They can also find out information from the local clinics, and also with other organizations who
So I hear you've done hospice for old people. I mean, what does that entail? Yes. Is it palliative care? Because I'm not sure what it is called. What entails that? Like if I were to call an institution and say, please come and help me look after my grandmother, what entails that?
Okay, if we are looking after your grandmother, because we provide palliative care. So palliative care means caring for patients with life-threatening illnesses or non-communicable diseases, or even end-stage organ failures and all that.
And what if you're just old?
If you are just old, the older person also has some issues. Sometimes they have non-communicable diseases. Sometimes, sometimes they may not have a communicable. Fortunately, that security is under our care.
Oh, that's great.
He's our patient. The medication that we give, we use our care through his son that you were talking to. Yes, so we also
so he's never been to hospital, but you bring the hospital to him.
Yes, that's what we do. And then there are also issues of maybe if there's dementia, or sometimes in the home setting there are issues, there are conflict. There's family conflict where you find that, like what we have we discussed before, that sometimes you find that the children are fighting among themselves. So in palliative care, we also come through that angle of supporting them. Of conducting family conferences so that at least one will run. Yes.
Sekuru, what happens if somebody, is there a law that protects anyone who abuses the elderly, or is it existent?
There are just general laws that protect any citizen.
Right.
Yes, but currently we also, but as we are, because we are going to soon we are going to amend the Older Persons Act.
Okay.
To make sure that we ensure that it has got safeguards for the elderly, because it states as it is more silent, and we have seen that there are quite a number of instances of elder abuse, which we really make sure that we need to nip in the bud.
Okay, so if, let's say, a community worker gets to a home and finds that there's elderly abuse, what happens?
Yeah, they are supposed to report, and then that's when we come in and we investigate. And this is where normally, if you find out the situation, we can then is not attainable. That's when we can talk to the older person, and then we try to organize alternative care for him. Either we move him to an older people's home, or if there are other relatives that are willing to take care of him, then we place him there, and then we continue to do monitoring.
Are there any government old people's homes in this country?
In this country, we do not have government, but we do have some that are run by local authorities, and then others, they were started by churches, and others by individuals. But the government is only there to support all those that way, whether they are privately owned or they are owned by local authorities
or by churches.
By churches, we provide what we call per capita grants and also administrative grants to make sure that at least to cushion the elderly in those homes.
And Munya, let's put this to bed. Yours is a church-based elderly home. What happens if someone, a professional, abuses an old person within the care?
What happens is we have got the code of conduct which we deal with, and normally we investigate and get the facts right. Then we deal with the case. Normally, if anyone abuses a patient, then they are on their way out. And then obviously, if it is an excess, then that means it has to be a police case.
All right.
Then the police will deal with it.
And I think a lot of the country, as a country, we are going towards a conscious drive to mental health. So Sister Francisca, if in the psychological support that one gets in the home as an elderly person, what are some of those, outside of just seeing your family, what else can be done for the elderly at home for psychosocial support?
Okay, because when we are in our provision of palliative care, we also attend to that aspect of providing psychosocial support and spiritual support.
Okay.
So how we manage that is you find out from the person when we are looking at the spiritual aspects, what do they want to do, and we support them in that. And the psychological support, you also communicate with them, counseling them, finding out if they have any problems, if they have any needs that they want, and all that. You also communicate, because in in palliative care, we work as a team. We work with social workers. So if we feel that this patient has issues, which the older person has issues that they want to talk about, we refer to our counselors,
right,
who are social workers.
And you know, one of the things that we always wonder, is that would there come a point where those above 70 will have free medical attention, free, you know, the free, because, you know, they're old. They're old. Really, we can't keep saying the kids, is there a chance where they will actually be comfortable in their elderly age?
Yes, currently, if you are 65,
you retire,
and above, you are entitled to, you're not supposed to pay any user fee even get to one's hospital.
Really?
Yes, and it's only that sometimes what you might fail to get in public hospitals is the medication.
Okay.
But if you come to our offices with the prescriptions, we'll provide that. We'll actually make sure that we buy the medication.
I didn't know that.
Yes. Currently, we're also working on a national health insurance scheme to ensure that everybody is covered whether from the vendor to the destitute who is on the street.
Right.
And we are also proposing a universal pension scheme to make sure that at least instead of them relying on handouts, at least they will be having something that whenever you get old, you'll be having a pension, whether you are working or not. So actually, we are also trying to come up with a universal pension scheme. So far, we have had an initial study on that, and I think it's promising that we will be able to start that one.
I think those are great initiatives that, I mean, I would want to now be old. Because all these things, are provided for us. And outside all these, and I applaud the whole free healthcare and pension scheme, the psychosocial support, how also can the government chip in to make sure that these old people, their mental is taken care of?
We do have social workers. Our offices are so decentralized to the district level, and currently we are also having community cadres whom we also train, and they also go through various refresher courses.
Okay.
And also what we would also want people to know is we also buy assistive devices for elder persons, and all persons with disabilities. So if an elderly person can no longer be able to walk, if they need maybe a wheelchair or they need the walking sticks, all those things we can, the government buys them, and
I think what's important is that these things are happening, but people don't know about them.
Sure.
Yeah. But we are glad that you're here and to tell us all these things. And I'm going to just take a round of closing statements concerning what you want to say to the elderly and what you really do advocate for the care of the elderly. I'll start with you, Monya.
What I would want to say is at some stage, everyone is going to get old. Even the government officials, like the boss who is here, can you kindly tell or advocate for a grant to at least maintain the infrastructure for the elderly people? Like
they need to build them. That's what you said. They are going to build them.
Yes, I mean the grants where, for example, Arthur Evans will come and apply for a grant so that we can look after these old people, because the funding is very, very scarce at the moment.
Okay, thank you. And Sister Francisca?
Yes, I'm looking at the older persons in the community.
Right.
That they should also, in fact, there are some who also have the community support groups. They have support groups for older persons where they go, and they also have older people who are champions. These champions are the ones who support the other older persons, and they are these champions are also in charge of making sure that the sick patients are also being cared for. The older persons who are sick are receiving adequate health care from the health facilities.
Okay.
Yes.
Thank you. And of course, Security Rivavi, please.
What I would want to say to the elder people there is that we are there to support you, and we also want to urge every Zimbabwean, whether young or old, to make sure that we respect our senior citizens. They have contributed to the development of this country. What we are seeing, it is their contribution as well they were going. And actually they're a good resource, they're a fountain of wisdom. A lot of information is amongst them. And if you look at the Sekuru that we have seen in the video, he still looks very fit.
Yes.
Yes. And so actually you could get the secret from what he said is not the truth.
Yeah.
If you sit down with him, he'll tell you the secrets and even the type of food that you eat to make sure that you remain healthy. So let's respect them. Even wherever we find we always meet elderly people, let's give them due respect.
Absolutely. Well, the story of the elderly, like rightfully said, we will all get old one day, but it is important for you to visit your nearest public service and labor social welfare office and find out what is available for you if you're looking after any of the elderly, so that we give them a quality of life and that they have a better ending and rest, of course, while they're still with their family. On that note, we end this show today. And if you are a runner or a walker, the Zim Papers Television Network, not just Zim Papers Television Network, Zim Papers Group, in collaboration with Island Hospice, has a cancer walk next Saturday, not this one, the following Saturday. So see press for details and you will get better information on it. But do follow us across our social media networks, ZTN Facebook page, and kindly also subscribe to our YouTube at Zim Papers Television Network, or follow us on Twitter at ZTN News. So keep abiding to the COVID-19 regulations. Stay safe, love the elderly. My name is Sokostina. On sign language is Siposihle Ndlovu. And from the crew behind the scenes and everybody from ZTN, thank you for watching. Good night.